Hi there, and thanks for joining us. I'm Julie Musgrave. For people living with a common heart rhythm condition known as atrial fibrillation or A-Fib, the standard of care is blood thinners. But for some, that's not a long-term option. Community Medical Centers is now offering something called the Watchman. Here's a look at how it works.
Every morning, Phil Parrish meets the boys for coffee. It's his routine. But Phil is also living with a heart rhythm disorder that tries to get in his way.
The left side of your heart has a little appendage that comes down. Blood has a tendency to collect in there, and it's not pumped out. It just collects there and coagulates, and from there it can come out and cause a problem.
It's a common result of A-Fib.
When you go into A-Fib, your blood flow is not efficient, and blood clots can form in that location. And if the clot escapes and gets to somewhere else in the body, and if you're unfortunate, it goes to the brain, then you end up with a stroke.
It happened to Phil in 2015, so he's been on blood thinners ever since. But doctors were concerned about his risk of having another one, so they recommended something called the Watchman device.
With this procedure, assuming everything goes smoothly, we can take you off all of your blood thinners and you don't have to worry about a blood thinner causing a stroke again.
The Watchman device essentially closes that pouch in the left upper chamber of the heart called the left atrial appendage. So what we do here, this is an implant-based alternative to blood thinners for patients who cannot take them, and this was FDA approved in 2015.
Dr. Palanaswani was a lead in getting the program started here at Fresno Heart and Surgical Hospital in Fresno. The procedure is minimally invasive and done through veins in the leg. A team of 3 highly trained cardiac doctors implant a small balloon-like device about the size of a quarter.
2 technical skill points in performing the Watchman device. The first is being able to safely cross the septum to get access to the left atrium, where the appendage is located. The second part of the procedure is correctly positioning the device in the atrial appendage so that it can prevent blood clot formation in that area and subsequent complications of atrial fibrillation.
Once we do this procedure, they usually take the blood thinner for the first 45 days. After that, we can stop the blood thinner. And the studies clearly shown that the incidence of stroke is markedly reduced.
Recovery is brief. Many patients go home the next day. In fact,
take it slow and you're good to go. You can, when you feel like driving, you go ahead, you can drive. So I said, okay.
It wasn't long before this retiree was back to routine, meeting the boys for coffee again. Phil is still on blood thinners, but expects to be off them soon.
So far, from my perspective, it's been a great thing for me and for my family.
There are about 10,000 people living with A-Fib in Fresno County alone. 1 out of 3 patients with A-Fib will have a stroke in their lifetime.